Hi, so let's move on to antipsychotic medications. Antipsychotic medications have become quite popular in the treatment of mental health issues. Before they were literally used just to treat psychosis, which would be, schizophrenia or major depression with psychotic features. But recent changes in the medications have made them useful in augmenting for treatment of depression, sometimes even anxiety, and so definitely a medication that you'll see in the field when you're working with your clients. The original treatment was for psychosis, like I said, but now it's quite different. And I'll just go through, starting with the history of them a little bit and up to the newer medications, okay? So there's two types. There's the typical antipsychotics and the atypical antipsychotics. The typical are the older ones and the atypical are the newer ones. They have variable absorption and metabolism and excretion. So that just means that the clinical effects can be seen as fast as 30 to 60 minutes in some medications or as slow as 2 weeks in other medications. They have multiple different ways to administer this medication. Some have dissolvable tabs that you just put on your tongue and it disappears. They have very quick uptake into the body. Others have IM injections, which is into the muscle. And there's also a depot injection, which goes into the muscle and leaves a pocket of medication that slowly releases over time. The medication accumulates in fatty tissues, and that affects how much you would give someone based on body fat. And the half-life of this medication can be up to 24 hours or more, which means it's in the body for a full day or longer once it's introduced to the body. So, the typical antipsychotics, the way they worked were they would block dopamine. They still do. They block dopamine receptors. They're not selective, however, though. So they block all dopamine receptors. These medications include Thorazine, Prolixin, Navain, L'Occitane, and Haldol. Haldol is still used quite a bit, so you'll see it in the field. It's a very cheap medication, and it works quite well, and that's why it's still very popular. However, it has quite a few side effects, and we'll discuss those later. Interesting to note, Thorazine literally changed the way mental health has been treated. Before Thorazine, people pretty much were institutionalized for life if they had any psychosis. At the introduction of Thorazine, people were actually able to rejoin the community even with a psychotic disorder because it brought down the signs of psychosis and made people able to function in the community without needing a hospital setting. It's a fascinating medication. I highly recommend you look into it further. Atypical antipsychotics block dopamine as well, but they are more selective, which means they block only a certain number of receptors. So they have less side effects, and some of the effects of dopamine are still being used in the person's body. These include Risperdal, Zyprexa, Seroquel, Geodon, Abilify, Invega, and a few others. There's large campaigns right now for Abilify and Invega and Seroquel and Risperdal, so I'm sure you've heard about that in the media. Abilify just got an FDA indication to use as an adjunct for SSRIs for treatment-resistant depression. So typical antipsychotic medications, they have very high potency, they're very strong, but that also means that with it comes very strong side effects. And some of those are movement disorders. So you'll see people who have been on these for quite a long time may develop EPS. And that can look like shaking of hands or a slapping of the lips, kind of repetitive motions that you don't normally see in an individual, and is kind of a telltale sign that they've been on an older antipsychotic for quite a long time. There's three different groups of the typical antipsychotics. It's called high potency, mid potency, or low potency, and I've listed them all for you to look at. Haldol is one of the high potency ones, and it's the inexpensive one that you often still see used. Some of the side effects of all antipsychotics, so that's the older ones and the newer ones, are cardiovascular disease. They can increase the risk of that. anticholinergic, so that means drying out of mucous membranes, weight gain, metabolic changes, endocrine changes, blood disorders like agranulocytosis. That one is with clozaril only usually, and because of it you track very closely the person's blood levels, and they have to come in often to get their blood drawn. With all of these medications, it's a good idea to track their blood, so we'll draw blood every 3 months, but for clozaril it's monthly. So I mentioned some of the side effects include medication-related movement disorders, and so I want to go through that with you briefly. There are some that are acute syndromes, and it can occur up to 90% of patients on antipsychotic medications. One of them is called dystonia, and it's just involuntary muscle spasms, abnormal postures, unusual eye movement. You may also see Parkinsonianism, which is rigidity, and akinesia, which is kind of a slow movement, and a tremor. Their face sort of looks more like a mask. They kind of lose their affect, so less smiling, less emotional response to any stimuli that they're seeing, and loss of spontaneous movements. And you also may see a shuffling gait when they walk. Akathisia is an inability to sit still, so they lose their psychotic symptoms perhaps, but then they feel very restless, and so you may be working with a patient that's on an antipsychotic who is able to do therapy with you, but every now and then has to stand up and walk around the room. That's not actually anxiety, it's akathisia. The etiology is related to the blocking of the dopamine in the nigrostriatal pathway. You don't need to know that, but if anyone ever asked, now you know it. The treatment is we can give Artane or Cogentin, which can sometimes reverse the movement disorders. So if you see these movements developing in your clients when you're doing therapy, it's a good idea to refer them to their provider and connect maybe with a phone call if you have a release of information, and report that you're seeing this, because you'll be seeing the patient much more than the person prescribing the meds. That's often how it goes, and so you may be the first person to see the development of a movement disorder, and it's very important that the patient get either Artane or Cogentin, or get the medication decreased or even switched. Chronic movement disorders, so these are ones that develop and stick around for a very long time, include tardive dyskinesia, which is the irregular, repetitive, involuntary movements of the mouth. I call it lip smacking, and I'm sure you've seen this before, but it's just an unusual and repetitive puckering of the lips, sometimes rapid blinking, abnormal finger movements, stuff like that. They usually show up about 6 months after the start of the treatment with medications. And they are irreversible most likely, so it's very important to report anything like that if you see it. And here's some more of why the medication causes it. Chronic dopamine suppression. It causes overactivation of the EPS system, and what we can do about it is change the medication, decrease the dose, or move to a different class of medications. Prevention is the most important thing, however. So we want to do tests on a regular basis to look for them, and one of the tests that we do is called an Ames test. It's a very simple, just body movement test that should be done every time the patient has a medication management visit if they're on an antipsychotic. And as a therapist, you can suggest to a patient that they get an Ames test, or they request one at the next psychiatric visit if they haven't had one yet. And like I said, here's a list of the medications that we can use to help with the movement disorders. Let's move on to mood stabilizers. These meds are for people who experience mood shifts, so from mania to depression. So it's bipolar 1, which is where patients experience an elevated euphoric or irritable mood at some times, and then a depressive, low, sad mood. And they kind of oscillate back and forth. That's bipolar 1. Bipolar 2 is where they get hypomanic. Patients get elevated moods, some euphoria, but it doesn't go all the way into a manic episode where they may need to be hospitalized. You may see increased spending, irrational decisions around sex and relationships, stuff that doesn't quite fit the picture for that patient when they're in a healthy and euthymic state. And so that would be hypomania. And they also can experience dysthymia, which is a low-grade depression or full depression. Okay? So for people where that's the presentation, we often use mood stabilizers, which bring the highs lower and bring the depression up. The important thing to know about them is that they're very, very useful. They work very well, but they also have side effects and monitored very closely. For instance, lithium, it's the gold standard treatment for bipolar disorder. It works very, very well. However, it has a very short therapeutic range. It can only be between 0.8 to 1.2. And anything below that is ineffective. Anything above that is toxic. So we have to see the patient regularly, and we have to get their blood drawn. This is something you'd want to remind clients on a regular basis if they start lithium. So anticonvulsants have been shown to work very well for bipolar disorder as well, and the most popular one I've seen is Depakote. It also requires that we do blood monitoring on a regular basis. It's very effective as well, and it's a very inexpensive medication. A lot of people also use lamotrigine or Lamictal. It works well, especially for bipolar depression, and it's often a patient's first choice, and the reason is because it has less blood monitoring needed and a lower side effect profile. You don't usually see weight gain, and you don't usually see any blood issues, and it has less of a chance of toxicity than lithium. Okay. For mania, which is full-blown bipolar 1 manic episode, only carbamazepine is approved for mania. We do use other medications, including lithium, but that is kind of where you go to when you see a manic episode. And the side effects include dizziness, drowsiness, tremor, visual disturbances, nausea, and vomiting. And we can minimize this by using the lowest dose possible, by giving it with food, and we want to watch for weight gain and hair loss with this medication.